So it's now September, just the beginning of September. Autumn has started, 2017. We've decided to use a different style frame to gain some expansion. We're going to use the Moon expansion device with some other, I will use Mariana Evans's angulation of screws, but I'll use the actual expansion screw of Moon because I was finding that Hyrax expander just wasn't really man enough for adults. Yeah, and was seizing up. And we placed that device yesterday.
Yeah.
It sits down nicely, and we've put all the neck gear on today. We've checked the tensions of the neck gear and the angulations. It all seems to be fine. Yeah. But tell me a bit, Fred. How was it? Was it fairly comfortable after we put that on?
Yeah. Yeah, it was fine. Fitted really well, no problems. You know, you feel a bit of sensitivity in the teeth, but that's to be expected when you're putting the appliance in. Other than that, it's fine. Yeah, feels good.
Okay. And we've been through various warnings. I mean, we're twice now, but we've given the sonic device. So the idea is that we place the sonic device on the left side. We focus on the suture here. Focus on the suture here. We focus on the sutures here.
Yep.
You soften those sutures slightly, so that will give us the sort of slightly asymmetric expansion in the maxilla. I mean, that's our idea anyway.
Yeah, it is. Yeah.
Any other comments?
No. Yeah, I think it's quite important to note the sort of factoring in particular asymmetries in expansion, and then I think the sort of the ultrasonic device is certainly a step forward in helping patients where you're focusing on how to move the maxilla forward, because of course the body wants to kind of keep everything as symmetrical as possible. For good reason, because that's how we function. So I think that's a good step forward.
And then we'll get you wearing the neck gear well. And when you're wearing the neck gear well, and we can see we've got the, you know, when you're pushing at the door, then we put the screws in and start expanding and literally open the door. We're going to do some work with Ian.
Yeah.
I've seen some good results. I think I was mentioning with this osteopath in Hendon.
Yeah.
We'll consider that. I'll start investigating that now. We're going to get you doing neck work, Kenzie chin tuck, some chewing exercises. You know, all part of the role. You know, this is the 1,001 little steps to make this go better.
Yeah.
Anything else you think we should add today?
No, I think we've covered everything.
How's your nasal passages and airway at the moment?
Rubbish. Yeah, I mean, it's either one or the other really. It's either I can't breathe at all, or it's almost the opposite end of the spectrum. It feels so. It's like my body's reacting to the fact that I can't breathe very well by doing the only thing it knows how it can, which is to just evulse my nasal cavity of blood flow. And then I feel in the opposite end of the spectrum. I feel like I can breathe so much that it's quite uncomfortable, and I'm never in between the two. And I think that there's probably a lot of people nowadays that are experiencing that sort of setup. It never feels quite right because the only thing your body can do is eliminate blood flow. It can't move bone.
No.
So I've tried to explain that to.
Well, come on. Come on.
I've tried to explain that to people, but I think
Okay. All right. Well, we'll run this video blog again as we progress, and you give me some feedback. So probably we'll do another one. Next on we'll place the screws. When we're ready to go, then we'll start expanding. And when we've got a little bit of expansion, probably have time to talk again.
Yeah.
Okay. Right.